I want to talk to you about the strange nature of symptoms that are caused by what we call a hidden food allergy. The reason it was hidden for so long, in fact till the end of the 20th century, was they're peculiar. They can be anything. And it took a long time to suspect this, but once uncovered, it's absolutely fascinating, the huge variety of symptoms and conditions that can be caused by this one simple phenomenon. In my writing, I've described them as food allergy symptoms as protean, bizarre, perverse, changeable, and paradoxical. What on earth do I mean? Well, first of all, protean, that's named after the Greek god Proteus, who was a great shapeshifter and could appear one thing 1 minute and then another thing following that. Okay, so it's a good word to remember, protean symptoms. Perverse means they often don't make any sense except to the patient. Remember, often the effect is on the brain, so a person's perceptions are altered, so they experience weird, abnormal things that you wouldn't typically expect a person to feel. But because the sensorium is disturbed, the person gets a very peculiar sensation of what's going on. That leads to all these bizarre symptoms. I said bizarre, and it can be things like, my legs are full of hot water, or the feeling of cobwebs in the face, or seeing myself in the distance down a long tunnel. These all sound weird, of course, and you can imagine what's going to happen if a patient goes to a doctor with these kind of symptoms. They're going to think, oh yeah, he or she's, kind of a bit crazy, a bit loopy. That's obviously the problem. Write them up for some psychotropic drugs or send them off to see a psychiatrist. That's another common one. It's all in the mind. I'm going to refer you to a psychiatrist. But that's not fair, because these really are subjective symptoms, but with an objective basis. And that some of them do recur, in fact. Same reason, they're very changeable, and that's another thing that bothers doctors. If it doesn't fit their comfortable syndrome of this symptom plus this symptom plus this symptom equals that autoimmune disease, say, or whatever, if it's things that don't fit in their textbook, they're rather childish and tend to be suspicious and misbelieve the person and think they're pulling their leg, having them on, or making it up, or whatever. And of course, that's very unkind indeed. But you can imagine if you're a doctor, the patient comes in, I've got this terrible pain in my back, doctor. And you say, all right, take these pills. And if it doesn't cure you, come back in a couple of weeks and we'll try something else. But the patient's back 4 weeks later saying, having terrible headaches at the moment, doctor. What do you think that could be? And so the doctor thinks, well, prescribe some, they're more likely to prescribe antidepressants, I think, than analgesics. But anyway, maybe analgesics. But then patients back, weeks later, they can't balance. Their balance is a little bit off, and they're having trouble. You get the idea. I'm just talking about symptoms that shifts and change like this. And the doctor's going to very quickly pass this person off as somebody who's got a psychiatric problem. They're sad or inadequate, and they're making all this up to gain attention and all this usual baloney, which is wrong. And I know it's wrong, and I found out it was wrong nearly 50 years ago by simply trying people on experimental diets. And they got well, often within days they got well. It all blew away and they never saw it again, providing they didn't eat the food, they stayed off the food, they were fine. So all this nonsense about they're psychiatrically inadequate or unfulfilled or trying to gain attention and so on, is all, and they don't really want to get well, it's just a mechanism to get through life or control other people. It's all hooey because the person recovered as soon as you gave them the right treatment. And so it's a great disservice for doctors, treating patients in this way. Anyway, one last thing I mentioned, which was paradoxical, and symptoms can come like that. The patient can have bouts of lethargy and too tired to do anything, mixed up with bouts of hyperactivity, racing around near mania conditions, or they can be, say, hot 1 minute and then they're cold, and they don't really understand why, or they have bouts of binge eating, they stuff themselves and gain, 10, 15 pounds, and then they feel miserable and desolate, and they can't eat. Trying to eat food just makes them ill, so they don't eat for weeks. So it's sort of an alternation between binge eating and anorexia. I've seen that quite a lot too. So you see, this can be tricky, not because the disease isn't tricky, it's certain foods are not tolerated and producing certain reactions by poisoning out certain parts of the body. But what's really tricky is doctors don't get this. They don't have the knowledge. They're just ignorant. And they want to blame the patient or come up with some other condition to explain everything. As I said, a patient's as likely to get treated with antidepressants as some kind of food allergy investigation. That's why a colleague of mine, one of my great mentors, wrote a book called Not All in the Mind, because it wasn't all in the mind. It was something happening to the patient, and doctors were misinterpreting it, or basically unable to interpret it properly. They didn't know what was happening, so they'd blame the patient. I'm going to send you to see it's all in your mind. I'll send you to see a psychiatrist. Okay, so just a little word there. They're very tricky, these symptoms. It's not just food allergy, but food allergies do it very commonly. And I often say this to people, everyone knows about allergies like hay fever, for example. When there's pollen on the breeze, person can't breathe, their eyes stream, they get headaches, they feel awful, just on tiny amounts of pollen on the breeze. So you can imagine, if you put 4 slices of bread in your mouth, and not all at once, of course, and you're allergic to wheat, then you're almost certain to get forced into some kind of physical complaint. We put large amounts of food in our bodies. We only breathe minor quantities of dust and house dust mite and pollen and things like that. So it really is a problem, and you've got to be on the lookout for it. Otherwise, you'll never guess. Okay, so this channel is full of little tips like this. This is from a practicing doctor with 50 years of experience. I don't Google for my information like most of the so-called health researchers. I have it here in my head. I have it in my heart from all those years of experience, and I'm sharing it with you. So if you like what you've heard on elsewhere in the channel, then please consider subscribing and join us, and I'll keep the tips coming. Okay, take care.